the colon, talk about that. Or we can retitle it Good, Bad, and Ugly and learn a little bit about what the colon, how the colon is good, what it does for you, and then a little bit about what can go bad and maybe ugly in some of the cases. So the colon is your large intestine, and it has all kinds of motor properties and nervous and motor properties to it, and that it contracts and moves things along in the appropriate direction. This is a quick clip from a colonoscopy. I just wanted to show you what the colon looks like on the inside. It doesn't look like much, pretty smooth walls, pretty plain, not all that exciting when you're inside, at least when we're in there with a scope. All right, let's get down to some more common situations. Everybody's familiar with this. This is probably the most common complaint across the board. All of us experience this at a little bit at some point, usually intermittently. And what is constipation? There are different definitions. All of you kind of think you know what it is, but are there formal definitions? So with constipation, we tend to consider it some difficulty with bowel evacuation or bowel movements that results in discomfort or some other discomforting or unpleasant type of symptom. Sometimes you do identify reasons for constipation above and beyond just constipation. Medications, a good number of commonly used medications, high blood pressure medicines, antidepressants, and so on, can slow the bowel down. So always need to look at that. How do we treat constipation? The first thing are just some lifestyle measures. Many people with constipation tend to have a reduced fluid intake or could use more fluid intake, which is just common sense. We talk about fiber perhaps helping constipation. It does in some cases, not in others. All right, the opposite end of the spectrum, diarrhea. This is unpleasant. We all get to experience this maybe once a year, once every other year, usually what we call an acute diarrhea, usually due to an infection or a food toxin. What's the definition of diarrhea? Generally accepted definition is just the water content of the stool is much more than the solutes or the solids in there can hold. And so it's a change in consistency. The irritable bowel syndrome, now many of you have heard of that. And the cardinal feature of irritable bowel syndrome is this significant abdominal discomfort that takes place. It is in conjunction with bowel habit changes, but the big feature is this very uncomfortable, crampy discomfort. The diagnosis is really made by, again, that history and physical, the discussion in the office, because there is no test that's going to confirm or refute irritable bowel syndrome. There's nothing to see, nothing to biopsy. It's a functional disorder of the gut. And so the diagnosis is really made in the discussion. Now, what's the cause of irritable bowel syndrome? You know that when we have that long a list, we don't know. So we have a lot of candidates and no certain suspects. So if one was to make some general recommendations about diet and colon health, these might be proposed, but by no means proven at this point. Reduced red meat intake is probably of some benefit in this area, particularly overcooked red meat. A lot of information growing about adequate calcium and vitamin D being generally beneficial for the colon, particularly when it comes to polyps and cancer.